Good afternoon. What's up, guys and girls? Yeah, this is Big Truck. So, I wanted to explain to you guys what's been going on with me recently. I've had some medical issues come up. Back in 2013, I had an MRI done by a neurologist, and he said that part of my cerebellum was lower than it should be. That's all he said. So, I've had all these symptoms, memory loss, dizziness, headaches, all this stuff. I've had them for as long as I can remember. Well, I was on Facebook one day, and this girl that I know, Megan, she was on Facebook saying stuff about this malformation that she has. And she's had few different surgeries. I don't know exactly how many. Could be more than a few. I do not know. But I was giving her some crap, just joking with her, because we all know that chronic illnesses they're tough to deal with. But we like to, give people a little bit of encouragement, stay positive. It's rough. And, because one day you could be feeling perfectly fine, and the next day you feel like complete crap where you don't even want to get out of bed. A lot of people think it's depression, but it's not. It's just, sometimes it could be. I'm no physician, but I do know a little bit about medical stuff. But, I was giving her some crap, and then I told her, my neurologist back in 2013 said that part of my cerebellum was lower than it should be. But he just brushed off. He said it was like nothing. It was like 1.3 centimeters or something at the time, which is 13 millimeters. So me and Megan were talking, and she then sends me the link to, I think it was I don't remember what website that was, but it showed 3 different people that had different symptoms. Well, figure 1, I was like, I don't have any of those, whatever. Figure 2, they're non-symptomatic, no symptoms at all, and I'm like, well, obviously I do have some symptoms, and they're pretty wild. And then look at figure 3, and I'm thinking, this person has like neuropathy, memory loss, headaches, sleep apnea. Thinking to myself, wow, I matched this person to a T. So what I ended up doing was, I went and saw my PCP, my primary care physician, and what she ended up doing was getting my results from 2013. The office called, got the results. I was on my way out to my car. Finally get to my car and get a phone call. And it was my wife. She works at my physician's office. It was my wife, and she said, "You're not going to believe what it says." And I was like, "What's that?" She was like, "You should come back in." So I walked back in the building. She hands me the report. I'm looking at it, and down the bottom it says, Chiari Malformation 1. So I'm thinking to myself, okay, I've gone through 3.5 years of where this could have been taken care of. That neurologist in 2013 could have sent me to get more testing. He could have, had me get the sign MRI where they show the actual fluid flow of cerebral spinal fluid, because when you have Chiari malformation, what it is, basically the skull. like that. But there's obviously you have the spinal cord that goes through here, through the opening. Well, imagine you have, okay. Imagine it's actually like that. It's a little bit tighter, but there's still stuff that the fluid can still get around it. Well, then you take your cerebellar tonsils, and they're supposed to be, just chilling up here. They're not supposed to be down in this hole. Well, if you go 13 millimeters down, guess what? It gets a little snug in there. So then it's a lot harder for fluid to get by, which ends up building up pressure. You get headaches, and then the compression of the cerebellar tonsils against the spinal cord can then cause some nerve issues such as neuropathy. So basically, I went 3.5 years without knowing that I had Chiari Malformation. Okay, so from middle of 2013 to the end of 2016. I don't know if I messed that up in the past, but it was December of 2016 when I went and talked to my PCP, and then she got the stuff that showed from the paperwork from the 2013 MRI. So I went 3.5 years. What kind of nerve damage could that have caused? Could that have increased since I had that? Between those 2 points. Because when I had my MRI in January of 2017, it showed that I had no flow on one side and minimal on the other. So I went and saw a neurosurgeon at University of Toledo Medical Center. He said that he was going to do bone only. I was like, okay, And I really liked the guy. He was cool. But I was kind of concerned with the bone only because I'm hoping to have one surgery and one surgery only. And with my herniation, I wasn't sure if bone only would help me. Since it was, they say 13 millimeters, but the neurosurgeon actually said that was more like 20 something. So he was gonna do that bone only surgery, and he told me that he wanted me to get it done by the end of 2017. Now, I didn't show any syringomyelias or syrinx, whatever it is, but I didn't show having one of those. Granted, they only did a cervical spine and a brain MRI. They didn't check thoracic or lumbar, but I think that usually with the backup or with the herniation, I think that usually the syrinx is in the cervical spine. Could be wrong. So I wanted to go get a second opinion after that, although I did really like that neurosurgeon at UTMC. Did really like him, but I wanted to get a second opinion from someplace a little bit bigger. because they always say to go to a Chiari specialist. Well, I've had some issues with insurance where we don't have the best insurance, so I have to kind of go to where they'll approve. And they weren't, you know, I wanted to go to like Dr. Gilmer up in Michigan, up in Detroit. But then I talked to my family physician, and he mentioned that he knows somebody up at University of Michigan that's a professor of neurosurgery, and that he asked me if I would like him to give him a call to find out who the best neurosurgeon at University of Michigan is for Chiari Malformation. So I said yes, you know. Well, he came back with two different names. Came back with Dr. Cormac Maher. It's Maher. Well, originally I did want to see him because I've heard very good things about him. Come to find out, he usually only deals with pediatric. Because he's over at, I think, Mott's at U of M, which is a children's hospital. So it was between him and Dr. Patil. Now, I did some research on Dr. Patil, and I was excited to see that he had a bachelor's from, I think, MIT. I think he, for some reason, I'm thinking he went to Johns Hopkins. I mean, the guy has an awesome resume. And then I went online, watched some of his videos. By the way, it's Dr. Parag, P-A-R-A-G, Patil, P-A-T-I-L. Awesome guy. So, I got the appointment set up. We had to go through some loops with insurance because of the fact that we have a HMO plan out of Ohio, and yes, they take HMO up at University of Michigan, but if it was HMO Michigan, it seems like it'd be perfectly fine, but we have HMO Ohio. But they approved it. Went up there, talked with him and his one of his nurse practitioners. I loved everything they were saying. He was saying that he has basically a fundamental disagreement about the bone only surgery, whereas what he wanted to do was he wanted to go in, do the laminectomy, which is laminectomies where C1 is, they basically cut the back part of C1 out. It kind of makes it so that the spinal cord has more area along with the cerebellar tonsils. And then he cut out, or he went in and he drilled out part of C2 because of how far the herniation was. How far down the cerebellar tonsils were from the, from the foramen magnum, which is the opening at the base of the skull. So he went in, did the laminectomy, then he did the craniectomy, which is where they, at the base of the skull, there's, this bone pretty much back here. What they do is they cut it some to make it bigger. Because our biggest problem is our brain is too big for our head, for our skull. I mean, I got this huge head. I wear a size 8 hat. Everybody, says that I have a big head, which I do. But, so, it's crazy to think that my brain is too big for my skull. But what they do is, they're basically just opening it up to make it so that there's more room for the cerebral spinal fluid to flow, because that's the main problem. So then he was telling me that he does do a duroplasty. Well, at that point out, when we were talking about it, I was a little bit nervous because the dura is not something that you can make a mistake with too much, because you can easily have a leak. There shouldn't be any bacteria that gets into it, but if some bacteria were to get into it, my anxiety was going crazy because I was thinking, oh, if any bacteria gets into it, I'm going to end up having meningitis. I had all these irrational fears about what was going to happen. And then after a while I thought about it. It's just my anxiety. I'm going to be perfectly fine. And then it was the day of surgery. I ended up going for pre-testing on October 10th up at U of M. Got all my pre-testing done, and then October 24th was surgery day. So I was supposed to be there at 11:15. Got there at about 11:10, checked in, got the pager that they gave me. Well, they gave me this pager, and they told me, okay, they're supposed to be calling you soon, but they're running a little bit behind. If you don't hear anything by 12:15, come and guess. I'm chilling out in the lobby with my wife, my sister-in-law, my sister, and my parents. I'm chilling out there. I was actually relaxed. I think I was probably less nervous than anybody else there, which was weird. I just get like that on surgery day. I've had my gallbladder removed, had hernia operations, had, this surgery that I'm talking about right now. I'm usually pretty much, cool for the most part. Well, 12:15 comes around, nobody comes and gets me yet. I'm going, talk to him about it. They say, well, give us a little bit more time. He's running slightly behind. So 12:30 rolls around, my pager goes off. So I'm like, all right, cool. Go back, and end up having to go back and get my wife because I was just in a hurry to get back there, get this crap over with. But I ended up going back getting my wife. We went back. They started everything. Had to get into a gown. They put in the IVs. The weird thing was, something that I've never had done was, they had where they go right into here in the wrist. What they do is they numb it up, and then they use a ultrasound machine to look at where your artery is, and then they it's like an IV basically. What it does is it makes so that they can constantly monitor your blood pressure with that, instead of having to use one of these damn things. But yeah, so they did that. That felt weird because I felt when he was in there, and it felt like he twinged a nerve, and my freaking thumb and index finger go numb. I'm like, oh, that's awesome, whatever. So yeah, they do all that stuff. They come by, they make me sign the paperwork, and the doctor comes by to see me. First thing I asked him was, are you going to do resection of the cerebellar tonsils? Because I never actually talked to them about it. So I don't know if that's something that he was going to do or not. Well, he said, we'll get in there, look at how it is, and go from there. He was like, I'm not going to say yes or no. He's like, it's a possibility. He was like, I just got to see how the flow is. So I was like, all right, cool. Well, I think about 2 o'clock or so, rolls around, or 2:30. I think it was about 2:30. 2:30 rolls around. They come and get me. They gave me some something. It was a little drug to calm me down. Because at that point I was getting a little bit anxious. So they gave me a pill, or gave me an injection of something that starts with an M. It's an anti-anxiety medication that they give you prior to surgery. So if you have to have surgery, it's like midazolam or something like that, I think. What you should do is you should ask them if they give you like a little cocktail or something to calm down. That's usually what they call it, a cocktail. But yeah, then they wheel me to the to the operating room, and I'm thinking to myself, oh man, this is cool as hell in here. Because, they wheel you in, you're laying flat on your back. I looked off to the left, see this big TV. It's probably like a 60-inch or so. And all it's got on is my big ass head. The MRI, the mid slice. I'm looking over there like, man, that's pretty cool. So then I look to my right. I'm thinking, what's that? Is that how I'm gonna be laying there? 'Cause that's weird. And I was talking to one of the nurses, and she was like, yeah. And I was like, because right where my knees would, because the way that she described it to me is, I was going to be laying basically on my stomach, but it was like, like this. They had these pieces that were like this. They're probably about that high. They're probably like some type of rubber or really strong foam or something. They had two that would be going like this pretty much and holding me, in a certain position. And then further south you could see these big foam rings. She said that that's where my knees were going to go. So my chest was going to be like, draw this out for you real quick. Doing a little quick drawing right here. Oh man, my foot looks like crap. That don't even look like a foot. Hold on. Alright. So basically, it's kind of a weird small drawing. But basically, my head's there. This is like my torso. See these things right here? That's what I was talking about with what was kind of like holding me up. And then here's my butt right here. Oh man. And then, my upper legs going down to, here's my knees. And then, those circular foam. And then pillows. And my legs will be going upward like that. Drew my arm right here. One of my arms. But and then what they have is they have this. I didn't see it. It must be like a vice or something that they put your head in, because I have two. Man, I really should have shaved my head. My hair is wicked today. But I have two spots on the side of my head where they must have like put screws in my head or something to hold it in place. And then right here was where it was. I had stitches right here because of the drain, some type of drain or something, because it was bleeding. And but I ended up they ended up, after they showed me the table, they put a mask on my face and told me to take some, or right before that, I said, man, I'm starting to get a little tired. The anesthesiologist said, yeah, that's because, I'm starting you on your medication to put you to sleep. And I was like, okay, cool. And then they put the mask on and said to take some deep breaths. I did about probably 5 to 10 deep breaths. Next thing I know, I'm out. I wake up, I see 2 ladies on my right, 1 lady on my left. Pretty sure that's how it was. If it wasn't like that, it was opposite. It was 2 and 1, but I'm pretty sure it was 2 and 1. But I remember looking up. It was probably like a couple seconds of that. The lady on my right said, "Stay with us. Keep your eyes open." I was out. I was out after that. Next thing I know, I wake up in ICU screaming and crying for help. I'm like, damn, what the hell? Well, come to find out, when those ladies were telling me to stay with us and keep your eyes open, I guess I didn't want to wake up from anesthesia, so they had to take me off of pain meds to get me to wake up. Now, when I think about what that was like, that was rough. That was probably one of the hardest and most painful things that I have ever dealt with. I don't think I've ever heard of anybody waking up from surgery without pain medication, especially after the surgery that I just had. I mean, that was crazy. I can now say that I know what a true 10 on that pain scale feels like, because when you see people at a doctor's office or at urgent care and they say that that their pain's a 10, but yet they're not screaming and crying, their pain's not a 10. It's more like a 5 or 6. I mean, heck, when I was saying I was in a 5 or 6, that was something that probably a normal person would have went to the ER for. But I do think that I can handle more pain than what people normally can, just because of stuff that I've had done already. But yeah, so it was rough. The surgery, they ended up, everything went fine. They did resect the tonsils because when he was in there, he saw how bad the herniation was, and he resected the tonsils, and then he noticed, that there was a huge amount of flow. So then when I got to the post-op room, I think it's the PACU, P-A-C-U, post-anesthesia care unit or something. Got there. I don't remember any of that because they can only get me to wake up that one time. Unless I was half out of it, don't remember the rest. But I do remember waking up in ICU, just, yelling for the nurse. Because I couldn't find, first thing I looked for was the controller that you press the red button to get help. That's the first thing I looked for when I woke up. Because I was in that much pain. I was, and I didn't really, at that time, comprehend where I was at. I knew I was in ICU, but I didn't I didn't comprehend that. So I had to end up yelling for somebody, and it had me in, I was crying. It was rough. But I hope that, if anybody watching this has to have the surgery, that you don't have to go through that part. Likely you won't. I mean, it's just something that happened to me. I do have weird stuff usually happens to me for some reason. I don't know why. A lot of times it's I don't know. My wife calls me a unicorn. But so I ended up staying in the hospital I had surgery Tuesday. Got out of ICU. I got to ICU at 1:30 in the morning Wednesday, and I think I was out of there by about noon or so. Because now, if I would have stayed in bed, I probably would have been in ICU longer. But when I had to go to the I told the nurse that I had to go to the bathroom. And I couldn't use a urinal. And I told her that. Told her I had to actually either be standing or just go on the toilet. Well, I ended up going to the bathroom. And then she asked me, do you want to sit in the chair? Or do you want to go back to the bed? She was like, it would look better to the doctors if you were sitting in a chair. So, yeah, I went and sat in the chair. It was a little bit more comfortable. Hospital beds suck as it is. So yeah, I got out of ICU pretty quick. A lot of people talk about being in there for a day or two. I was out of the ICU in less than 12 hours. But then I went to a room on the neuro floor. The one thing that I didn't care for is it was semi-private. So I had a roommate. I just had freaking brain and neck surgery, and yet I had a roommate. That part wasn't that great. But pain started to go down. I was getting up by myself, going to the bathroom. Sometimes